All right, everyone, we're going to go ahead and get started. I want to say good morning to everyone. We really appreciate you taking some precious time out of your schedule to join us this morning. I know it's that crazy time of year. Everybody's trying to get ready to sell, certifications, everything needs to be done all at once. So, again, I just want to say thank you to everyone for taking the time, and we really think that there's going to be a lot of valuable. Okay, sorry about that, everyone. So, yes, we have a lot of valuable information. We've got the ACA open enrollment period coming right around the corner, and we wanted to make sure that you got the most up-to-date information on what your favorite carriers are doing. This webinar is going to be primarily for the Texas and Florida markets. So if you're an agent that's marketing in those territories, I think this will definitely be worth your time. But before we start, I also want to say thank you to Adam Grimaldo and Jocelyn Castillo. They are the broker managers for both Texas and Florida. Adams also has New Mexico and Utah. They are great resources, so if you haven't introduced yourself to them, you're going to want to do that. And also what I wanted to show you is our main homepage here, Messer Financial Group. So every agent can go to this site. It's www.messerfinancial.com, and there you're going to find basically everything that you would need to know for any kind of product, basically, how to submit business, how to certify, whatever the case may be. But for this purpose, what I wanted to show everyone is just a real quick on how to get to our quoting tools. I know everybody's going to want to quote and compare the rates to all the different carriers. So if you go to under Agent Resources on our homepage, at the very bottom, you'll see a tab on there that says Quote Tools. When you click that, there's going to be basically a quote tool for every product that you want. Life insurance, health, under 65, Medicare, whatever you're wanting. But for our purpose, we want to look at the ACA software. When you hit Health Quotes, you click on that, and then it will take you to our quoting system. Now, this is completely free of charge for anybody that wants to use it to quote. Now, if you also want to use it to enroll and you have your Molina contract with us, you will also have this free of charge and we'll be able to use it for quoting and enrollment. If you do not have a carrier with us, you're still welcome to use it. It is a $65 charge, and that's something that we do offer. But you can use this free of charge to quote, and then if you have your Molina with us, you'll also be able to enroll with it free of charge. So just keep that in mind, guys, whenever you're thinking about whatever direction you're wanting to go into. So again, this quote's just to show you how easy it is to quote. I'll just use a North Carolina zip code just for this instance, 28227, just a zip code. Ask you the county, Mecklenburg, gender. This is all that's needed. It's very simple to use and very quick. So we'll do 1/1/1980, and then we'll hit next. And again, this is completely free of charge for everyone. You can pick which product you want to do. If you want to quote short-term medical plans, gap plans, dental plans, vision plans, whatever you want. But for this purpose, we'll just say medical. If you want to see if they qualify for a subsidy, you would hit yes. So let's just say that this person does qualify for a subsidy. And let's just give them a $20,000 income, one person in the household, and then calculate. It'll tell you what percentage of poverty level, the total estimated subsidy. Hit next. And there you go. It's going to show you all the different plans. It'll show you what the full premium would be. It would show you what the estimated subsidy is, and it'll also show you what the total cost is after subsidy. You can get plan information, provider lookups, whatever you want. It's all available right there. You can filter it by certain plans. If I want to filter it by, looking at just silver plans, bronze plans, you can do that. Whatever the case may be. So, guys, it's a great tool. It's useful. It works in every market of every state. I highly recommend it, and you can do an enrollment all within about 7 minutes tops. And one other thing I want to show you, if you have missed webinars in the past or you want to go back and see this one, under Agent Resources, again, we post all of our webinars. So under Messer Learning Center, you'll click that, and then you'll be able to see the ones that were just added. And there you go. There's all the different webinars that we've done because we do quite a few of them. I know it's hard to keep up, and time is scarce right now. So again, we just want to make sure that you have all the tools that you have. And another one that I highly recommend is the short-term medical. That's also going to be, since you're doing ACA, this is going to be a big play for you guys as well. So if you haven't done so, go back and look at some of these webinars. If you have questions, we're going to hold all questions to the very end, and we will answer those at that time. And if you want to contract with us, we can also help you with that. But in the meantime, I am going to go ahead and turn this over to Adam Grimaldo, the regional broker manager for the Texas, New Mexico, and Utah markets. And Rebecca, if you will go ahead and switch it over to Adam's screen, and then we'll go ahead and get started on that. Adam, it's all yours. There's your screen. Adam, you there, buddy?
Yep, I am here. Can you guys see my screen?
Yes, we can.
Okay, perfect. Thank you, Micah. Thank you for the introduction, and thank you, Messer Agency, for putting this together for Jocelyn and I. As Micah mentioned, Jocelyn and I oversee the Texas and the Florida markets, and we are super thrilled to have this opportunity to share a little bit about Molina's story and about our product for this upcoming year. We definitely feel like it's going to be a great opportunity for everyone that is working with us. And so we are super excited about that. This is actually my first time to double team with one of my counterparts to do a presentation. So cross your fingers and let's see how we run this show real quick. But let's go ahead and just start with the first slide here. One of the biggest things that we talk internally within our organization is the value and the importance of working with GA partners like Messer, as well as agents like you that are on the phone. Most of our success is attributed to the fact that we've created some really good and strong partnerships with agents and agencies across the country. And honestly, we wouldn't be here if it wasn't for all of your guys' efforts. Overall, we'll show some numbers, but about 60% of our overall enrollment across the country comes from agents or agencies like yours. And we really are very appreciative of the fact that we are able to work with you guys, and we want to continue that partnership for many years to come. One of the things that is super unique to Molina is the fact that we have a very special story. Our company was founded by this handsome gentleman here. His name was Dr. C. David Molina. He was an ER physician who saw the need for someone to have a primary care home, a medical home where they can get their routine type of care. He would see a lot of folks come in to the ER with, things like a cold or a fever or an infection, and knew that it wasn't the best place for them to be there, both financially and for their continuity of care. And so he opened up a small clinic in 1980. And from there on, our company has kind of trickled along and became, what it is now. We started with multiple clinics in the California area. Then we were awarded a Medicaid contract in California, which is called Medi-Cal. And from there on, we acquired different RFPs for, programs like Medicare, Medicaid, and CHIPS across the country. Currently, we're in 13 different states. We have over 4.6 million members, which is, a huge feat and accomplishment for us, and we're expecting to continue to grow over the many years. And really, our mission is to provide quality healthcare services to the financially vulnerable family and individuals covered by government program. And then this is mainly the main reason why we are participating in the marketplace, because of the fact that it does have government assistance in the sense that folks can qualify for cost sharing reductions as well as subsidy assistance. For those that aren't familiar with Molina, Molina has been, around for a long time, and we are part of the Fortune 500 list. We say this more to reassure our partners that we are here to stay and that we are continuously evolving with the ACA market, and we hope to acquire more membership as the years go on. And so it's a super exciting time for Molina. The ACA product was the fastest growing product for the company in the whole time they've been in business. And it's a very good team that we got here that helps support this product. We won't go through all of these, just we want to make sure to kind of give you guys all the right information so you can have it. And this presentation will be available after the training. We will send this over to Micah so that he can send it out to all those folks that have joined the call. But just a couple things to remember, for the FFM site, states like Florida and Texas, open enrollment starts on November 1st. It goes until December 15th. And January 1 effective dates kick in the following year or on January 1st. But straightforward. I think everyone's very familiar with the time frames. There are some passive enrollment windows that you definitely want to be mindful of. Make sure that you are actively enrolling your clients on a yearly basis so that you can ensure that your NPN number is attached to all the policies that you've worked with over the last couple of years. So Molina is currently, or going to be for 2019, in 9 different states for the ACA product. We're in California, Florida, Michigan, New Mexico, Ohio, Texas, Washington, and the 2 new states that we're moving into is Utah and Wisconsin. We were previously in those 2 states 2 years ago, and our team has made the decision to go back into those 2 states. So Utah and Wisconsin, we're starting from the bottom and growing back up again what we were, a couple of years ago. So very exciting time, and yeah, it's going to be good. For those that are in Texas and are interested in selling in the Texas state, we are in 9 different counties. We're in Dallas, Houston, Collin, Jefferson, El Paso, Hidalgo, Webb, Starr, and Cameron County. Some of our more competitive markets are as follows. There's 6 of them that we really are making a big push, and I've spent a lot of time in the last couple of weeks to do a lot of trainings. Those 6 counties are Dallas and Collin County, El Paso, Harris County, which is Houston, and then you have Jefferson right to the east of that, and then Webb County, which is the county of Laredo. Those are some of the 6 best opportunities that we're going to have. The market share is wide open, and pricing looks to be very competitive. One of the biggest advantages that we have in the state is that for the price that we are at, there's no competition that has the network that we do. There's definitely some new players in the Texas market, but as new players, they're still developing their provider network across the state. So that's one of the biggest advantages that we do have, is the fact that our network is great and our benefits are fantastic too. So we'll talk more about both of those things in the next couple of slides. And I want to go ahead and just turn the time over to Jocelyn to talk a little bit about Florida and the counties that we're in, and she will kind of share some of her intel with you guys.
Hi, everyone. So basically in Florida, we're not going to be expanding this year. We're going to stay in the 5 counties that we're in right now, which is it's going to be Duval, Osceola, Pinellas, Polk, and Hillsborough in North Florida. And then in South Florida, we have the 3 counties, which is West Palm, Miami-Dade, and Broward. We're not going to be expanding. We are looking very competitive as far as bronze plans in a lot of our counties. Specifically in Jacksonville, we're looking really good as far as our bronze plan. We're very competitive as far as hospital network. We have the Baptist Hospital in South Florida. We also have the Baycare in Tampa, which is requested by members. We're currently trying to expand our books in Osceola and in Duval as far as providers, because they're very much needed. So we're looking into getting providers contracted. We're very competitive in Florida. Our BSU team is excellent. We always have tons of good recommendations regarding our BSU team. They're always there to answer the phones to you anytime that you need. So yeah, in Florida, we're definitely not going to be expanding this year, but we're looking very competitive when it comes to bronze play. In South Florida, the advantage that we have that Ambetter doesn't have is that in South Miami, they don't have a hospital, and we have the Baptist Hospital. A lot of the members are always seeking to go to Baptist, even though maybe there's a price difference. They'll be willing to pay for it, just knowing that they have a hospital a couple miles away from their home versus having to take a 10-mile trip to go see a hospital up north. So that's always an advantage when it comes to South Florida. Another one is that 80% of our book comes directly from agents. So this is a good thing because a lot of the Floridians are more inclined to go to an agent. They feel more comfortable going with an agent versus having to go to a facility or having to call Marketplace. They're more trust in the agent versus having to do anything themselves online. You can go to the next slide, Adam. To continue selling our products, we ask that you have your Florida license, and in this case, your Texas license as well. We're being very strict when it comes to errors and omissions that we have terminated a lot of agents due to not having the E&O. And trust me, we do not want to terminate you, but it's extremely important that you keep your E&O up to date And of course, your FFM certification should have been completed by now. If any of you have not, I suggest you go in and make sure that you have the certificate up to date. Make sure that you're sending over your errors and omissions to us. If you see that it's going to expire in a month from now, my suggestion and advice would be for you to contact the provider which you have your E&Os with and have them automatically auto pay it. So that way, you don't miss. Sometimes we don't even notice that we're missing a payment. So make sure you're up to date with that. Make sure that you send it over to us. You can send it to BSU, and if you feel more comfortable, you can send it over to myself or Adam, and I guess we'll be forwarding over to BSU. But as long as you send it over and we have proof that you sent it before it was terminated, you have to be able to keep the contract with us. Keep next slide. I like showing this slide, and I always put it on my presentations, and it's a big hit. And I think for Florida, we were very close in 2017 to reach the 400,000 members. And our motive this year is to keep the book that we currently have and grow a little bit. We know that we're never going to be able to reach such numbers again without the agents. That's why we're 100% agent friendly. We support agents as much as we can with marketing materials, with trainings, with everything that can facilitate for you to be able to reach the customer. So yeah, I always love putting this slide because I want you to see. We had a tough year last year, so I like for you to be aware of what's going on. And as far as Florida, we want to continue growing the book. We want to go back to the numbers that we had, and we know that we're not going to be able to do it without our agents. So it's important for us to be there for you. If there's anything that you need from us, for us to be able to facilitate it for you. So in Florida, you have a good opportunity this year. That knowing that a lot of the membership that we lost, it's going to be accounted as new membership, and you'll be paid for it as new. Not as renewal, even though they had us 2 years ago or a year ago. This membership now that we used to have, if it comes back to us, when it does, you'll be paid for it as new members. So that's kind of the advantage that you have in Florida right now. Anything with Texas, Adam?
Yeah, with Texas, I mean, it's been a steady incline over the last couple of years, guys. Still a great opportunity to still capture more of the market share. There's a huge population, obviously, in Dallas and in Houston, where we do have a big presence, but there's still more opportunity to penetrate that area. And just to kind of piggyback off of what Jocelyn was mentioning, yeah, we did definitely take a couple hits. In Florida, we pulled out of Utah last year, and Wisconsin, and we lost a lot of membership. But one of the things that we want to be extremely clear with all of our brokers is that last year's price increase and membership loss was a strategic move, in the sense that with our new leadership, our new CEO, and a lot of our new senior vice leadership, or in the company, there's been a lot of improvements, a lot of course correction in our infrastructure and how we process certain programs that we have, so that we are more efficient. And so in order to do that, it's easier with a smaller book of business, hence the reason why we bled out a little bit last year. But it's we're in a position where we're setting ourselves up for a really good opportunity in the years to come. As Jocelyn mentioned, not so much maybe in the silver tier this year in Florida, but there is great opportunities in all of the other states that we're in, Texas being probably the biggest opportunity, as well as California, to really rack in some new membership and get those first year commissions, as Jocelyn mentioned a few minutes ago. So it's a great time to start working with Molina, get familiar with our programs, get familiar with how our benefit designs work, and what type of networks we have in the individual states that you're selling in. So
something that I like to mention too, Adam, is I always tell this to my Florida agents. The good opportunity that you have, for example, New Mexico, there's so much opportunity there. Sometimes in Florida, when you don't feel like there's pockets where you're able to make sales or retain membership, there's always another state. New Mexico, like Texas, like Adam mentioned, there's so much opportunity there. There's barely any agents in New Mexico, as you have mentioned previously to me. So definitely get your non-resident license and tap in, and there's so much membership that can be obtained. I mean, this chart alone, it just tells you that how much of the membership just comes from the agent. And imagine of a pie of being 100%. If only in New Mexico, for example, 27% comes from an agent, you have the rest of the pie for you to be able to capture as an agent. That means that this membership is with us, but it doesn't have an agent attached. So the opportunity is definitely there for you to be able to grab some for yourself.
Yep, exactly. And one of the things that you'll notice on this slide, guys, and this is by far my favorite slide, is the fact that all of our averages, so the blue circles above the individual state participation, are the CMS averages for all of the other all of the carriers that are on the ACA market. And it's with every state that we're in, we surpass the state average of broker enrollments. And so it comes to show the level of interest and commitment that we have with the broker channel to continue growing and making sure that we facilitate a lot of our enrollments through our broker partners. So on these next two slides, guys, there's a lot of information here, but let me just focus on a few that affect Florida and Texas. As I mentioned, you guys will have this information. All the details that are in red are the changes that are occurring in each individual states. So for Florida, and Jocelyn, you correct me if I'm wrong at any point, we are going to be discontinuing our Molina options plan, which is a bronze and a silver plan that we would offer there. We're going to be doing the same thing in the Texas market, where we're eliminating our options plan. Reason for that is, we have a new administration in office. Their enthusiasm for the ACA product is very low, to say the least. They've tried their very best to repeal it and to eliminate it as much as possible. So they are limiting and minimizing the amount of funds that they're going to be providing to market and to promote and to provide new or continue any features that are on healthcare.gov. And one of those features was the options plan that would pop up, so people can choose that. And so that is no longer an advantage to us to have. So we're going to be discontinuing that and just focusing on our consumer choice plans, the plans that Molina has designed themselves. And I'll talk about in Texas about the state mandatory plan that we have. It's a little unique in our portfolio, but yeah, that's really the biggest change in the Florida and the Texas market. So for those that are interested in seeing our 2019 plans, this is a quick glance at what our FFM benefit package is going to look like. So anyone that's any state that's part of the FFM platform will have the same plans across the state. As I mentioned, there are some states that might not have a bronze plan, or that will not have the options plan, but all of the plans will have our consumer choice plans. That includes a silver product, a gold product, and in most cases a bronze product. So out of all of the information that is here, there's a couple things that I would definitely want to point out. As everyone I'm sure is aware, last year in October or so, President Trump got rid of the CSR funding. But one of the things that is important to remember is that although the funding was eliminated, the CSR programs and benefits that are being offered is still required by the law that each carrier has in their portfolio. So that's the reason why here you will see 4 different silver plans. It's not to say that we're going to have 4 silver plans on the exchange. It's going to be one of these that the individual or the family would qualify for. So based on their zip code, their income, their household size, they will qualify for one of these. And our silver 100 plan to our silver 200 plan are our cost saving or our cost sharing reduction plans. And that's where our members will get some additional assistance on the responsibilities of their deductibles and their copays and their co-insurance and stuff like that. So a couple things, we made some enhancements to our plans, one of which is in our gold tier. We've reduced the deductible for the 2019 plan. We're going down to a $2,925 deductible. Our out-of-pocket max has decreased also. It's a $5,000 out-of-pocket max. And as you can see in our gold tier, it's a very robust benefit package. It's an 80-20 plan for most of the services that we offer. So the member's only responsible for a 20% co-insurance, and then Molina takes care of the other 80% once they meet the deductible. And as you can see, we have our urgent cares that are very affordable. It's a $35 copay. Our PCP visits, it's only $10. And then if they have any need to go to a specialist, it's a $50 copay. So across the board, the Gold Plan is a very popular plan for anyone that obviously has any chronic or long-lasting health issues, and that's a plan that typically gets used for that. I know that was a very popular plan for us in New Mexico, where it was actually more affordable than our silver plan last year. So, you know, with all the changes that were happening with the premium hikes in the silver tier, the gold plan was a $0 premium for a lot of folks in some of our states. So a couple things that I also want to mention in the silver tier is, and in our bronze and our gold tier, is that we have a feature that's called, that we kind of refer to as our deductible waive feature, which means that we have a list of services that our members can utilize without having to meet the deductible. So on this slide, there's a few indications on how you can see that. So any service that does not have a triangle next to it from the ER section and down means that those services our members do not need to meet their deductible. So if you take a quick look, all of our urgent care visits, our members only pay the copay for those services and not have to meet the deductible. All of our PCP visits, member just pays the copay and there's no deductible. That also includes our bronze plan, which is very unique. Most bronze plans has a high deductible, and usually most clients have to meet the deductible before they get any of their services covered. So our urgent care and our PCP visits are unlimited in our bronze plan, and our member only pays that copay there. So very user-friendly type of plan designs. As you can see in all of our silver tiers, there's many services that our member is only paying the copay or the co-insurance, and they're able to access the services that they need. And this really goes back and speaks volumes to, you know, what we do within Molina. Going back to our mission is to really provide quality services and quality plans to our members, so that not only do they, you know, pay for their premium, but they're able to pay for the services that they're seeking for. And when you have to pay a deductible, that's almost impossible to do. So a very user-friendly plan. And it's something that I think everyone will benefit from if they choose Molina for this next open enrollment season. Jocelyn, is there anything else that you wanted to add on this slide?
No, Adam, I think you covered everything.
Okay, cool, thanks. Okay. Let me go to the next one. Here we go. As I mentioned, in the state of Texas, we have two different benefit designs. They're a bit confusing. The state of Texas has a mandatory standard plan that every carrier has to provide. We don't promote it very much, but we are including these in the training just so that you're aware of it. Our Texas standard plan will be a more costly plan. Our premiums will be a little bit more expensive. One of the things that I want you guys to be mindful of is when you guys are enrolling someone in the state of Texas, that our standard plan has the $0 deductible across the board. So from our silver to our gold plan, just be a little cautious about when you see that. If it's a lower income individual and they're below the 150% of the FPL level, they'll qualify for this silver 100 plan here, but they'll also qualify for our consumer choice plan, which were the plans that we just discussed in the last one. But as you can see, our consumer choice plans are richer in benefit. The co-insurances are much, much less, and the deductibles and the different out-of-pocket maxes are way less. So if someone qualifies for the consumer choice silver 100 plan, make sure that you enroll them into that and not into the Texas standard plan, which has a $2,000 out-of-pocket max right here, okay? But as you can see, you know, as you go up the tiers, our co-insurance is much more expensive. So you have a $25 co-insurance for the silver 150, a 50% co-insurance for the silver 200 and the silver 250. Excuse me. Excuse me. So just a you know, just to mention that, and please make sure to kind of pay attention to that. And if you are enrolling anybody, please choose the consumer choice plans. I think that they have a better benefit package than our standard Texas standard plan. Okay, a couple things that have changed in our marketplace plan design are as follows. Our ER services have moved from a copay to a coinsurance. We're trying to encourage our members to utilize the proper facilities for their routine type of care. As you all know, the ER is intended for a life-threatening situation or a very severe situation. If a member doesn't have that kind of circumstance going on, we really want to promote going into an urgent care or to some sort of PCP office to kind of get the routine care that they're looking for. Hence the reason why we also made a change to our urgent care copays. We've reduced the cost sharing portion for our members to make it more affordable to them and to also kind of incentivize people that use the urgent care. In our consumer choice plans, we also separated the deductible for our Silver 200 and our Silver 250 plan. So there is a separate RX deductible for Tier 3 and Tier 4 drugs, and the deductible is only $400. So that's a small change. It's not a huge deal, but there is a separation on those two metallic tiers. And then the last thing on as far as our plan design is concerned is we also changed our RX tier definitions. And it's actually kind of a unique thing where this is a huge benefit to our clients and our members. As you can see here on the left column, in 2018 and prior, this is how we defined our prescription drug tiers. Tier 1 was generic, Tier 2 was preferred brand name drugs, Tier 3 was non-preferred brand name drugs, and then Tier 4 was specialty drugs. What we were finding is that there is a lot of brand name drugs out in the market right now that are just as affordable as generic drugs. And so our members, because of just how they were defined, were having to pay the Tier 2 copay because they were a brand name drug. And so what we did this year is we changed our Tier 1 to low cost, generic, and brand name drugs, so that for those lower or the less expensive brand name drugs that our members are using, our members would only have to pay the Tier 1 copay. So it is a huge advantage to them. The next tiers kind of go as follows. Tier 2 is preferred generic and brand name drugs. Tier 3 is non-preferred brand name drugs. And then Tier 4 is generic and brand name specialty drugs. So small improvement so that our members get more affordable prescriptions in that Tier 1. The other thing that I wanted to quickly touch on is that we also have a Tier 5. It's categorized as preventative drug tier. It's basically an over-the-counter program that we have. So if anybody looks up our Tier 5 drugs, we have a list of medications like aspirin and ibuprofen or some vitamins that our members can get for a $0 copay. So it's a free over-the-counter benefit that they have. And I believe there are some limits, but they'll at least be able to get a couple of those fills for those routine type of over-the-counter medications that they get. Okay. So one of the things that we also want to promote is that our members enroll into our My Molina website. It's our member portal. This is an advantage for you. It helps them to be a little bit more self-sufficient, self-reliant on their healthcare needs. Once an application is submitted into healthcare.gov, it only takes about 24 hours for us to receive that membership information. When our clients enroll into My Molina, they have the ability to do many things. They can change their PCP, they can make their premium payment, they can check on their claim history, things like that. So it's a very advantageous account to have for them, so that they can have more control of their healthcare needs and be able to kind of keep in touch with what's going on with their health insurance. This is what our mymolina.com website looks like. To create an account, the member goes down here where it says create an account, obviously, right? And to get started, they put in some of this information. From what I'm being told is that they really, to just get the account started, is they just need their full name and an email address, and that will get it so that they can actually start the account. So very easy to get into. We also have a cell phone app both on the Apple Store platform or the Apple products, as well as the Android products on Google Play. The Health in Hand app has all the same features as our mymolina.com website. So we highly recommend that you guys help your clients download this. This is a portable way for them to keep track of their healthcare needs. The app is super easy. Same type of setup as molinahealthcare.com. I'm sorry, MyMolina. And as I mentioned, they have access to change their PCP. They can have an electronic copy of their ID card. They have access to find doctors on the app so that they don't have to use the provider search tool online. But it's a very good way for them to stay connected and to utilize all the services that we have for them. As I mentioned, you can also make a payment on here, which is really cool. I believe it's on the next slide here. They can actually make a payment on here. You can set up just a one-time payment, or you can do the full year payment if they really wanted to do that, so that they can have those credits applied for the next couple of months. But it's a very simple way to keep track of that.
And I love that we have Adam, because a lot of the times, a lot of members, sometimes they lose their credit cards and they forget to call the insurance. And it's nice having the application on you so that you can just make those kind of changes really quickly without having to call a member service directly, or having a lapse of coverage due to non-payment.
Exactly. Yep. So the message behind that is, guys, just make sure you guys download this app as soon as you guys are done with the enrollment. It's going to save you guys a lot of headaches if the client has access to this, for sure. Okay, one of the other things that we also wanted to kind of cover is the fact that, with our new leadership, there has been a lot of improvements that we're making. There's a lot of new initiatives that we're focusing on, and we wanted to highlight probably the 4 more important ones. The first one is, the fact that we want to make sure that we're providing all brokers and clients the most accurate provider network out there. Just making sure that the information is correct and as accurate as can be. So we're going through a whole network audit in all of our states. We're reaching out to all of our providers, making sure that we have all the right contact information, all of their right addresses, making sure that we have all of their clinical support that's there, whether they have nurse practitioners or physicians in their network, things like that, but just to make sure that they are participating with us so that we can have the right information on our provider search tool. And that's going to help out everybody. I know that there's some agents that might have seen some of the pains of that, but it's getting better as the time goes on, and it's nice to see that our new leadership is really focusing on that. Something that I think is also equally as important is the fact that we're also making sure that our claims process is accurate and efficient, in the sense that we're paying all of our claims appropriately, so that our provider partners are satisfied with how we work with them. The worst thing to do is to have someone enroll into a Molina plan, and then they go to their doctor and they're like, they don't pay on time, or they don't get us the information in a timely manner. Those are the type of things that we definitely want to move away from, and that's why we're making sure that all of our systems are paying out correctly, so our providers are happy with how we do that. So it's been cool to see that probably in the last 4 or 5 months, and I'm sure Jocelyn has seen this, but the amount of calls that I get with claim issues has dramatically dropped in the last few months, as far as how many brokers call me and say, hey Adam, can you look into this? This is going on with this doctor and this member, and it turns out that it's very few and far in between now with all the things that they're working on. So that's really exciting. And then we're also making some huge improvements on our member service department. We got a new VP there. They're really focusing on being a one-call stop for our members, making sure that all of their claims and utilization questions or issues are resolved as quickly as possible. So please feel free to refer your clients to our member service department. They are of great help, and we will talk about some additional help that you have as brokers to handle some of these member issues if for whatever reason the member can't do it themselves. So we'll talk about our care team and our broker support team in a minute. And the other big thing is this next one is a little bit more complicated, but it's really important, doing the wellness assessments and identifying members' medical necessities as soon as possible. When we get a new client, we don't get any medical history from the previous plan that they're in, or from healthcare.gov about their chronic diseases. And so it's super important for us as a healthcare company to identify those things so that we can assist them in the constant process that they have of going to see specialists or having to go get certain services done on a monthly basis, or whatever the case might be. So identifying those clients and putting them into our case management or into our disease management programs will help us to help them in their chronic issues. So very exciting time. Like I said, there's an increased enthusiasm within our organization with all the things that our senior leadership is focusing on to, one, provide a better product to our members, but two, to be a better partner for our broker partners. So it's super exciting. I get this question quite a bit, and this is one of the reasons why we wanted to include this piece here, is that a lot of clients still have the question about, hey, when am I going to get the ID card? So let me kind of walk you through how all of that works. When someone fills out an application, that application gets sent to healthcare.gov. Every night, healthcare.gov sends each carrier their 834 file, which is a membership file. And those files are what triggers two things within our organization, and that is a welcome letter as well as a binder invoice. The member will not get their ID card or the welcome packet until their binder payment is completed. And so having to go through those steps is sometimes why there is a delay. If a member asks, hey, why haven't I gotten my ID card? It's because they probably haven't paid their binder payment, and that's what we need to focus on. So what we encourage all of you as brokers to do is, once you guys fill out the application, you guys take the route to the bottom of this screen and make their payment as soon as you're done. After every application on healthcare.gov or on Health Sherpa or any quoting tool that's out there, there is an option to pay now. And when you do that, the member's information generates into our website, and you have the ability to make their first payment, set up a reoccurring payment with the auto draft program that we have, and get them all set up with that. So highly recommend you guys do that. There is an additional benefits of doing that. You guys will also have the opportunity to choose a PCP once you guys make that payment, and then once you're done with that, then the ID card and welcome card will be sent out shortly after that. So it kind of resolves that question or that issue that members have about when they're going to get their ID card and the welcome packet. Okay, a couple dates that we definitely want you guys to remember about, and that is our binder payments are due before the first of their coverage month. So for example, in November 1st to December 15th, all those individuals that enroll during that period will have a January 1 effective date. So we need to make sure to collect their binder payments prior to that January 1 effective date. Okay. Any month after that, for example, like if they're trying to make their or stay active for the month of February, they need to make their premium payment on the 25th of the month prior to their coverage month. Okay, so, and then anyone that's enrolled into the auto pay functionality, their auto pay window is on the 23rd of the month. So if they're going to have their coverage for the February, it will be deducted on the 23rd of January. And if the 23rd lands on a Saturday or on a Sunday, then that will be deducted the next business day, which would probably be that Monday that follows. Okay. Okay, a couple ways that you can make premium payments for your clients. The first one, as I mentioned, is the auto pay functionality. That's only available in two different scenarios. One, when they pay their premium or their binder payment after the enrollment. So after you're done with the application, you have the option to enroll them into the auto pay functionality. If they don't do it at that period, then they can go to mymolina.com and enroll into the auto pay functionality there. Those are the only two ways that they can do the auto pay. Okay, and if they have any changes or any corrections with the auto pay, they have to do that through mymolina.com. They can't call into the member service line or to the broker line to do that. Any changes, they have to do it on MyMolina. Okay. We also have online tools to make their premium payments. They can go to molinapayment.com or mymolina.com to make a payment through any MasterCard, any Visa or Discovery card. They can also use their savings or checking accounts to make those payments as well. So pretty easy, pretty straightforward. And then they can also mail in their payments if they wanted to. And if they wanted to pay cash for whatever reason, if they don't have a checking account or a credit card, we are partnered with MoneyGram, and they can go to any of the MoneyGram locations across the country to make those payments. Just encourage and remind the members to take their premium invoice into MoneyGram so that they can have the account information and they can allocate those funds that they're paying to their account when they go in. Okay. One quick update when it comes to the auto pay functionality. There is only one way that our members will automatically be discontinued or canceled from that program, and that is if the member loses their APTC, which is their subsidy, and if the member's portion increases by $100. So let's just be very clear. Both of those things need to happen in order for the auto pay functionality that they were enrolled in for this year will be discontinued for the following year, for 2019. So if a member actually loses their subsidy, but their premium only goes up $99.99, that auto pay functionality will not be canceled. It will stay active and they'll have to pay that increase of the $99.99. So just be mindful of that. Typically, when someone loses their subsidy is much more than $100, but just be mindful that both of those things need to happen if they want to be canceled from that. And as I mentioned, if they want to disable the auto pay for the following year for 2019, they got to go to mymolina.com and do it before the 22nd of the month so that it doesn't run on the 23rd for the following month. Okay. And this is what our fancy ID cards look like, guys. Yes, they're still going to be made out of paper. So make sure your clients are opening up all of their Molina correspondence. Make sure they're looking in all the envelopes that we send them because their ID card might be in there. But yeah, pretty straightforward. They'll get this information, once they pay their binder payment. If they're a new member, if they're active renewals, they'll get sent during open enrollment. And then if they're a passive renewal, which means that you don't actively enroll them, they'll get sent out a new ID card in early January. Okay, so this is where you can access our provider search tool. This is molinahealthcare.com. This is our main page, I guess. There's a couple of tabs here on the top of the page. You have a find a doctor or pharmacy. Right next to that is our provider brokers tab, where you can have your guys' information and access to our broker portal. But our providers tool is pretty straightforward. Once you click on that little tab that I just mentioned, this is what pops up. You have find a pharmacy, find a provider, and find a hospital or facility. The search options are, pretty straightforward. Search by city, search by county, search by street. I would recommend that you guys search by city or zip code or by county. Those lists seem to be more broader, and there's more options there. You click the state that you're looking for, the city and zip or county, and then the most important part is make sure that you guys on this coverage section here, make sure you guys put Molina Marketplace there, so that you guys are accessing the ACA/Marketplace network and not any of our other products. Okay. And then you put the provider type that you want, search, and then it generates a list of all the hospitals or providers that you're looking for. With that, I'll go ahead and let Jocelyn talk a little bit about the Florida network. It looks very robust, so I'll let her spend some time on this.
Awesome. So yeah, the Florida network right now, I gotta say it's really, really extensive. The only areas that you may come with a little issues will be in Osceola County. We're looking to expand to more providers. Right now we only have Osceola Regional and Winter Haven, that's really close to Osceola, and Duval. We have Memorial and Shan. So as far as every other county, we have basically every single hospital in the counties. I don't know if you've been with us for a while, but you remember in Florida when we first started, we only had Jackson Memorial in South Florida and Miami. And now we practically in Miami to have everybody, including Baptist Hospital, which is the most highly requested hospital in Florida. So we have that one, and we're looking to expand more. As far as Duval, we're looking to do St. Vincent. I know it's a highly requested hospital. And in Osceola, we're definitely looking to add more. A lot of the times we get asked if we have the Florida hospital network, and we don't. They currently do not work with anyone in particular as far as carriers. So we know we do not have the Florida Hospital Network, but Osceola Regional is really fantastic. A lot of the members really like it in Osceola. They're very familiar with it. It's very centralized, so it's right in the middle of Osceola. So a lot of the members have no problem using it. As far as Hillsborough, we have Tampa General Hospital, which is probably the most liked hospital in Tampa area. And then in Broward, we have all the memorials. We do not have Cleveland Clinic, and a lot of the times we do get asked that. If we don't have Cleveland Clinic, but the memorials are. If you're very familiar with the Broward area, you know that memorial hospitals have the different hospitals in all of the Broward area, so it's not one particular area. So a lot of the West Broward County citizens love going to the Memorial Hospital. In Palm Beach, we have the Palms West Hospital, very liked hospital by everyone in the area, very centralized as well. And just Palm Beach, really, we have basically all the hospitals. So we're really happy and content with the network right now. We're looking to grow our network, as I mentioned, in Osceola and Duval. If you have any questions, or if you have, I think right now is the perfect time. If you work currently with a provider that you would like to submit information to see if they can get on board as far as Duval and Osceola, now will be the time. We're not adding any more doctors in any of the other counties, except for Osceola and Duval. So if you have any recommendations that you'd like to make, please, they're definitely welcome. Yeah, right now you'll get this presentation and you'll be able to see the hospitals in the areas for yourself. Adam?
Thanks, Jocelyn. Yep. And so I'll go ahead and quickly showcase what our network looks like in Dallas and in all the other counties that we're in. Our network, I think the more slimmer network that we have is in the Dallas area, but we have made some improvements over the last 6 months to add some hospitals and some providers that will be of great help for us. One of the newest additions that we have in the Dallas area is our partnership with the Methodist Hospital System. So we have 3 new hospitals in the Dallas County area. So it really is a big help to us. And then some of the other partners that we have are, hospitals like Parkland, Medical Center Dallas, Mesquite Specialty, things like that. A lot of the medical center facilities are throughout all the counties are part of our network. So, Dallas is probably one of our slimmer networks, but it's definitely improved over the years. Collin County, we don't have too many issues there. We have Medical City, McKinney, Methodist, and then Centennial in that area. So pretty good network in the Collin area. Our Harris County network is probably our most robust network on all the counties that we have. This is what a mature network would be, kind of to Jocelyn's point there. It seems like Florida has a very mature network, and it's results of a couple of years of negotiation and working hard at it and getting to the point where we're at, because we were in the same boat as Jocelyn mentioned in Florida, where our first year, second year, our network was a small fraction of what we currently have. And so it's a work in progress. And as the years go on, it only gets better. If there is any sore, pain points that you guys have, I know all of us as broker channel managers within our Molina organization make it a point to stay in frequent contact with our brokers. So if you're having any specific questions or issues or concerns with any particular doctor or specialist or hospital with your clients, shoot us an email. We usually stay on top of that, and we make sure that we incorporate any of our local teams to help out with that, whether it be sending out provider service reps to do some more education, or to problem solve a claim that has been going on. But we really try to help out wherever we're needed so that the member experience is better. But yeah, I'm sorry for Houston. Yeah, we got all of the big players. So we got Memorial Hermann, which is a really prominent hospital system in Houston. We also have all of the facilities in the Harris Health System. We have the St. Luke's of the world, St. Joseph's. We also partner with the UT physician groups all across the county. So all in all, great network, great provider network also, and a really good opportunity in that Houston market to really showcase Molina. One of the things that I should add is that in our Dallas and in our Houston counties, there is a shift in the lowest cost silver plan. We will be losing that slot this year, but we're not talking by by a whole lot. We're talking maybe 10 or 15 bucks, depending on where the client is at. But the biggest argument that we have is that the competitor that's going to be priced lower than us does not have a network like this, in no shape or form. They're just building it, and they're still just getting started in the Houston and in the Dallas area. So there is some major opportunities to put them in a network that will support them in their medical necessities, and also provide them with a good provider base so that they can choose the PCP or specialist that they're looking for. Real quick, we also have Jefferson County, El Paso here. El Paso is a big market for us. We haven't penetrated that market very big, but our broker participation is really high there, and so we want to continue that trend there and really increase our membership as much as possible. I think the same thing applies there, where we're not the cheapest silver plan, but our bronze plan is phenomenal. Our silver plan is only $12 or $13 more expensive than the lowest price silver plan. But then folks look at the provider network and they realize that our network cannot be beat. So a great opportunity in the El Paso market to also pick up some membership there if you're interested. And then this is the Rio Grande area. Really the only area that we're very competitive is in the Hidalgo and Stark County area. They're very small communities, so unless you live there, oh, actually, I'm so sorry, I take that back. Starr and Webb County are the two counties that we're going to be most competitive in. Those are very small communities, so unless you're there, I don't know how much opportunity there is, but just to kind of throw that out there. Hidalgo and Cameron County are where most of the population is in the South Texas area. We have a great network, great provider list. Our pricing just has never been very competitive there in the last couple of years. So I'm waiting for the day that is. We have some great broker partners there, and I know that we have a lot of broker partners across the whole country that would definitely be interested in that particular sector of Texas. But waiting for the day that actually happens. So hopefully it'll be next year. One other big update is that we, going back to us eliminating the barriers of, urgent care and reducing the copays, is that we also brought on some new partners in the Texas market. So we partnered with Mountain Star / ACA. It's a hospital system here in Texas, as well as in Utah and a few other parts of the country. But they have urgent cares all over the place. They have a urgent care in Denton County, our regional urgent care facility. And then they have many, I think it's like 30 plus urgent cares across the counties of Dallas and in Houston. So this is a great opportunity for us to kind of promote the fact that we want folks to go to their urgent care and to utilize our newest partnership with Care Now in those counties that we're in. This is what our broker portal looks like, guys. So when you're on our molinahealthcare.com website, if you go to the broker section, you have access to sign into this. If you don't have your username, please feel free to call into our broker service department, and they can provide you access to that number, and then you can reset your password. Our passwords are they've actually been updated. They only get reset every year or so, or every year. It's better than what we had the last couple of years. I think they were getting reset every 3 months, I think, maybe, Jocelyn? Yeah, I think it was every 3 months.
Yeah, they were reset every 60 days, and now it's every single year, which is awesome. Yeah. And a lot of agents are happy about it.
Yeah, it's a big deal. So in our broker portal, guys, there's access to your book of business. You guys have the ability to access our partnership with Health Sherpa if you guys are in need of that. But all in all, I would highly recommend that you get very familiar with your book of business section in your broker portal. It gives you all of your clients' information, from their names, telephone numbers, their date of birth, their subscriber IDs. It even tells you when they are in their grace period, when they made their last premium payment, so that you can be on top of that and make sure that you reach out to them to help them out with that. And as most of you guys know, commissions are based on premium payments. So if your clients aren't paying their premiums, then obviously those commissions won't get paid out. So very important that you guys stay on top of that and make sure that you are aware of all of your clients' policy needs. And then this is some more information on mymolina.com. I think we covered most of it, so I'll just skip this. There's a couple of little cool things here. I know Micah mentioned the quoting tool that you guys have available through Messer. This is just another option for you guys here, guys. Health Sherpa is coming out with something called the Enhanced Direct Enrollment. Over the last couple of years, they've been having to do, single or double redirect with their enrollment platform, which meant that, you would start on Health Sherpa, quote them, select the plan, then you'd have to go to healthcare.gov, get the members' login information, their password, and sometimes members wouldn't even remember what that is, so it would make it a pain in the butt to kind of get that access and get them enrolled. And then they would come back to Health Sherpa and then go back to healthcare.gov to finish the application. So it was a very cumbersome process. It was very hard to stay connected. There was just a lot of really difficult things to have to go through with the way that it was set up. With the way that things are shaping up in the political world and the attitude that the administration has towards the ACA, as I mentioned before, they're not looking to dump any more money into it. They're not looking to enhance the member experience. They're not looking to market the ACA. They're not looking to fund CSR, navigator programs anymore. So really, this opens up a window for companies like Health Sherpa to be the front runners in the enrollment process. And if the companies pass all of the safety measures and all of the safety requirements that Health Sherpa has, they will have the ability to have the enhanced direct enrollment experience, which means that when you as brokers are enrolling someone on Health Sherpa, you will never have to interface with healthcare.gov. You don't have to remember the members, email address. You don't have to remember their password. Everything will be accessible on Health Sherpa without having to do all of the crazy things that healthcare.gov made you do in the last couple of years. So with that being said, I highly recommend that you guys look into Health Sherpa. I believe they're one of 2 companies out there that have been qualified to have this enhanced direct enrollment feature for 2019, where you're just strictly working on Health Sherpa, and you guys will have full access to uploading documents, looking at their premiums, enrolling them, making their payments, all of that stuff, and even getting your renewals from the previous years. You can pull your book of business from healthcare.gov into your Health Sherpa account and have that readily available in your Health Sherpa account without having to interface with healthcare.gov. So highly recommend that you guys look into that. I know that Jocelyn and I's directors are putting together some sort of training on Health Sherpa so that agents can be more familiar about it. It'll be WebEx based, just so that you guys can kind of log in for 30 minutes and kind of see what they have going on. But it's very beneficial, something I encourage everyone to look into and see how you guys can be more familiar with that. A couple of updates, guys. These are just some regulatory updates. Just make sure that you guys do not list your emails on your consumer's account. That's how we get notified of some kind of potential fraud or incorrect practices. Just make sure that you guys are including your consumer's email address in their application so that all correspondence go directly to them. It is something that healthcare.gov is making a very big point to do, and this is just a practice that we need to follow. Okay.
Yeah, Adam, and I'll touch on that. It's there are rumors that healthcare.gov is going to be long gone in years to come. So try to I know that change is a difficult thing to adapt to, but try to use other systems. Now that we have the Health Sherpa, try to integrate yourself, get used to it, because healthcare.gov may be gone, and creating emails, there's tons of times that members are calling in healthcare.gov and they don't know the email to their account, they don't know the password. You don't want an investigation to start on your behalf and then potentially lose your license for creating a dummy address. So if a member does not have an address, my advice would be to have the member create their account through their mobile devices or computer, and you can facilitate it, you can help them, but do not create it for them. Do not create it on your computer. Do not be the one to create it and save it. Make sure that you list this information down, because tons of the times Adam and I always have investigations made, and most of the time, members are claiming that they don't even know the agent. And of course, members are always going to be correct. So try your best not to create any of these addresses, just to be safe. Make sure that you don't lose your license for something like this. really important.
Cool. Thank you, Jocelyn. And just one point of clarification, guys. When Jocelyn means that healthcare.gov is going to be gone, what she's referring to is that with this new administration, the focus is to have private companies like HealthSherpa be the handlers of the enrollment process. And at some point, healthcare.gov might just be a back-end data housing tool for companies like HealthSherpa or Quoted or ACA. What is it, ACA Express and stuff like that. So it will be a back-end use more so than it is a customer-facing portal like it is right now. So one of the other things that we want to also update folks on is creating I guess we already kind of touched on this, right? Creating a consumer healthcare.gov account. If you're the broker, just make sure that it's the member's account and not yours. Our care team, guys, this is, I mean, I think we're very unique in the whole industry when it comes to how we interface with our brokers. I've heard stories about other carriers, they don't even answer their calls. They don't have adequate support for brokers. Whereas with us, our main focus has always been to support our broker partners because of the amount of participation that you guys have had with us. And we've actually created a team called the care team that helps with escalated issues for marketplace members. And so, for example, if a member has access to care issues where they're trying to get medication or need immediate medical services, our care team can help with that. As I mentioned, our members are referred to our member service department, and typically our member service department does not talk to our brokers, even though they are the agent of record. So this team is to kind of help support you guys in the needs that your members have. So you can call our care team and they can help with member related issues without having to jump the hoops of validating or having the member on the call and stuff like that. So they also help out with billing issues, or if there's any enrollment issues that you have with healthcare.gov. Sometimes they have been known to terminate a policy or not include a dependent on the policy. Our care team can be the liaison for you guys to do that. So I highly recommend you guys refer some of those problems to them. It basically gives you the opportunity to avoid a 2 or 3 hour call with healthcare.gov to get some of those issues, and just have our care team be the ones that take care of it for you. They have direct contacts with healthcare.gov and can get those issues resolved much quicker than you calling in. So highly recommend you guys utilize them. They're the best in the industry, guys. Trust me when I say that. I've heard that from all of our broker partners. It's rare that I ever hear any negative comments about our broker support team. So please utilize them as much as you guys need to. This is the telephone number where you can access our broker support team and our broker care team. It's the 855 number. Option number 2 is the broker care team, and then option number 1 is the broker service team. And if you wanted to just email them, you can email them the scenario or the escalation issue that you have. This is their email address. It's mpbrokercareteam@molinahealthcare.com. And if you want to provide them with the information that you're needing help with, this is the information that we need. Client's name, date of birth, the state that they're in, their subscriber ID, and then just a quick description on what's going on. And then our broker support team, as I mentioned, they help out with information on our benefits and looking up EOCs, looking up broker communication or member communication, stuff like that. But they're phenomenal and they're great to work with. We have an amazing director there. Her name is Jamie. And then we have 2 managers, Rhonda and Summer, that are just always on top of it all. They're just always making sure that everything gets seen through and gets completed. So we have a lot of confidence in them, and they end up saving me and Jocelyn's butt a lot of times. They just are always on top of everything and really do go above and beyond to help out you as brokers. And then this is all of their contact information. So I'll leave it here for a second so that you guys can jot it down. And if I'm not mistaken, I think this is the last slide. Oh, the broker support stuff. So I'll leave this here for a few more seconds so you guys can write this down, and then I will just kind of showcase who our partners are in different states. So if you guys are marketing or promoting your your services in different states outside of Texas or Florida. We have some amazing broker channel managers in our other states that are great to work with also. So we will go ahead and kind of showcase who they are. We have Jim in Washington, Amy in California, and then we have Jocelyn in the northern and central Florida area, and then Ohio, Michigan, and Wisconsin now, right, is Kasai. So please feel free to reach out to any of these guys in those particular states if you have any questions. I oversee our Utah, New Mexico, and Texas markets. So please let us know if there's anything that we can do to support you guys. And that is it. So we will go ahead and turn over the time to Micah. Micah, we're done with the presentation, and if there's any questions, we'll be happy to answer them for you guys.
Awesome. Thank you so much, Adam and Jocelyn. That's a lot of really great information. I think we all learned a lot of valuable stuff. And I just want to point out a few things, because at the end of the day, guys, all of you agents out there, you can choose your partners, whoever you want to be a partner with, carriers, FMOs, whatever the case may be. And I hope after seeing a lot of this that's being offered from Molina, you'll see that they are a great company to partner with. They care about their clients. They may not be the cheapest, but it's not always about, the company that's cheap. It's about the company that you keep. And it seems to me that with their advancements as far as customer support, agent support, and I'll tell you why it's such an important thing that they really respect agents, is the fact that it's job security for us guys. I mean, they are really looking out for us. They understand the value of agents and agencies. So again, if you're going to be a partner, I would want to be with someone who's moving in the right direction, doing the right things for their clients, expanding, and just overall going to be here for the long haul. So, and also with Messer Financial, highest commissions, software, like I said, agent support, whatever you need, we're here to help you out in that regard. So if you haven't contracted with Molina and you need to get contracted, please call or email Messer Financial. You can reach us at 704-568-9649. It's also on our website, messerfinancial.com. Contact us anytime. We'd be happy to get you contracted and ready to go. And like I said, I think Messer Financial and Molina would be a great partner for any agent or agency out there. So keep that in mind. Just to go over some questions real quick that we did have. One question was, does Molina have any off-exchange offerings in Florida, specifically Central Florida?
No, we do not.
Okay. Is the co-insurance based on the contracted rate in Florida?
Can you repeat that one more time? Sorry.
Is the co-insurance based on the contracted rate in Florida?
On the contrary, it depends on the. It depends if they're talking about the bronze or the silver.
Okay.
1 second. 1 second. Let me get that for them. So, for example, like in the bronze, we did change. Before, the members had to go in and, if they wanted to go to a primary care doctor using the bronze plan, they had to pay the $35 for 3 times to visit the primary care doctor, and then it will apply to the co-insurance and deductible. Not anymore. Now it's just a flat $35 rate. They can go see the doctor as many times as they like, their primary care doctor. So it also depends on the plan. We'll be able to send over the presentation so that they can oversee it and then they'll be able to read it. And if they have any questions, my email is there, and then I'll be able to respond to them as well. Beautiful.
Another question, someone was asking, are the rates in Florida, your guys' rates, going to be competitive? I know you briefly discussed this with Blue and Ambetter. Is that going to be something that you guys are going to be competitive with? And if so, what areas?
We're going to be competitive in the bronze. The bronze is going to be our biggest play in Florida. Last week we had Blue Cross file again on us. So if I were to give you a price right now or a rate, so where we're at, it can potentially change today or tomorrow. What I'm seeing right now, as far as so many changes happening, the only county that does not change much is it's Duval in Jacksonville area. We are looking real good in the bronze play and a couple dollars off in the silver plan. As far as the other counties, it's hard to tell right now. I don't want to tell you that, we're looking great and then prices come out and it's not what we anticipated right now.
Gotcha. And that's another reason why, if you guys want to check out and compare the rates too, you can always use our quoting tool anytime and get those rates as well. So, as far as commissions go, feel free to contact us. We can discuss that on one-off basis. We do have the highest commissions in the country, so we can absolutely get you hooked up on that. Here's a question. For policies rolling over, the draft dates will be 12/28 to make sure the client has not changed their plan. The actual binder payment is still 12/31 by 11:59 p.m. Is that correct? So I can read that one more time if you'd like.
Read that one more time, please.
Sure. It says for policies rolling over, the draft date will be 12/28 to make sure the client has not changed their plan. The actual binder payment is still 12/31 at 11:59 p.m. Correct?
Yes, it is.
Yes, it is.
That's what I figured. Okay.
That's going to be like probably your best rule of thumb for anyone that's either actively renewing, passively renewing, or is just going to be a new member. Just make sure that they don't get past that, December 31st cutoff date, and they should be fine for the next month.
Perfect. Is Baptist Hospital and Network for Florida or just for emergency?
I didn't understand that. What's for emergency?
Is Baptist Hospital in network or in Florida?
Baptist Hospital is network, but it's in network in South Florida, not the Baptist in Jacksonville. It's the Baptist is in Miami. It's in network, so you can go to it as your primary care doctor. You can also go for emergency. It's in network.
Gotcha. It looks like there's 3 more questions. Is it necessary to get a referral from a PCP to see a specialist?
In Florida, yes, you do need a referral.
And in Texas, it is not. So as long as the specialist is contracted with Molina, they can go to any specialist and not have to have a referral. Now, once they go to the specialist and they're asking for specific services or procedures to be done, there might be a prior authorization that's needed for that. But to actually go see them, as long as they're a contracted provider, they're okay just to go directly to their office if they wanted to.
All right. For people who have a pending balance from 2017 or even prior years, will Molina deduct that pending balance from the 2019 binder payments?
Yes. Any payments that were not met in 2018 will roll over to their 2019 policy. So, if for whatever reason they termed the last 2-3 months of the year and they wanted to enroll with Molina again the next year, they will have to pay those remaining balances that they did not pay. And I believe that's applicable to all carriers across the country. They're doing that. They've been doing that for the last year or so.
Is there a way for an agent to see if the client does have a pending balance?
They can call into our member service department and see if they do have one from the previous year. Or our broker service team can help our brokers to identify that too.
And lastly, it says, last question is, what if a consumer does not have a computer or email address? What's the best way to enroll them?
I would highly recommend just get familiar with Health Sherpa. I mean, you don't have an email for the customer. The broker goes in there,
100%. Yeah.
Puts in their information and all that stuff, and I mean, they will ask for an email so that they can send correspondence to them, but it's not a requirement to actually get the process completed. So.
Perfect.
Yeah, Health Sherpa is such an amazing tool to be able to, use and get adapted to it. And just the portal, like the Molina portal, I always advise the agents to get familiar with it. In the mornings, open your portal, like you work from home, you're remote, open up your portal, have it open for any questions that come in. You can check anything. Every Friday, pull a report to see how many members have not paid or to see if they've paid. I mean, you can literally be up to date with what's going on with your members on a daily basis. And Health Sherpa is going to even be better for the agent. So I would highly recommend, like Adam said, to be start using it and get very familiar with it.
And I'm sorry, actually, there was another question that came in. Can you put up the care team phone number again?
Sure thing. Hold on a sec. There you go.
And it looks like there's a question. Will you have a call center for taking applications from enrollees?
At this particular point, I believe that we don't. I'm sure that there is some things that we will be looking at. I know that our member service department helps out and provides opportunities for folks to get enrolled. But I mean, I haven't heard of anything being established quite yet. So.
All right, well, that looks like it's all the questions. Again, I want to thank everyone for taking the time to join us today. Adam, Jocelyn, we appreciate you doing this for us. A lot of great information. I think it's going to help our agents a ton. And again, if you have not contracted with Molina, if you need the contract or you have questions about your contract, please contact us, Messer Financial, directly. You can go to messerfinancial.com for all of our contact information. You can also call us. Again, it's 704-568-9649. You can ask for producer support or even speak to one of the marketers and myself. Adam, Jocelyn, is there anything that you guys want to close with?
No, just let's get out there, sell Molina products, and
definitely.
It's going to be a really exciting year. And then, not only that, please contact Messer for, commission information. We have a very competitive commission package for both new membership and renewals. And, we definitely have made some big strides in improving that for this next year. So keep in contact with Messer and they'll give you those details. But yeah, very exciting year. Let's get out there, sell some Molina products. And if you have any questions or concerns, please let Jocelyn and I know.
Yeah, if you have any questions or concerns, definitely let me and Adam know. And I'm more than happy to, if you ever need anything, you can give me a call and we'll be in touch. And thank you very much for taking time of your morning to be able to listen to me and Adam.
Thank you, everyone. Everyone have a great week and good luck out there. Thank you.
No, thank you. Bye-bye.
Bye-bye.